Eczema, also known as atopic dermatitis, is a chronic skin condition that causes inflammation and irritation of the skin. Atopic refers to a person's tendency to get allergic conditions such as asthma and hay fever. It is a common condition that affects people of all ages, but it is most often seen in children. There are several types of eczema, each with its own characteristic symptoms and triggers. The most common types of eczema include 1. Atopic dermatitis. This is the most common type of eczema and is characterized by dry, itchy, and inflamed skin that often appears in patches on the face, neck, and limbs. It is usually associated with a family history of allergies or asthma. 2. Contact dermatitis. This type is caused by an allergic reaction or irritation to a particular substance, such as soaps, detergents, metals, or plants. It can appear as a rash or blisters in the area where the substance touched the skin. 3. Nummular eczema. Appears as circular, coin-shaped patches of dry, scaly skin that can be very itchy. It often appears on the arms, legs, or torso. 4. Seborrheic dermatitis. This type of eczema affects areas of the skin that are oily, such as the scalp, face, and chest. It can cause red, scaly patches and dandruff-like flakes. 5. Dyshydrotic eczema. Causes small, itchy blisters on the palms, fingers, and soles of the feet. It is more common in women than men. 6. Stasis dermatitis. This type occurs in people with poor circulation, typically in the lower legs. It can cause swelling, redness, and oozing of the skin. 7. Neurodermatitis is characterized by thick, scaly patches of skin that are often very itchy. It is usually caused by repeated scratching or rubbing of the skin. The type of eczema that a person has can be determined by a dermatologist based on a physical exam and medical history. Eczema is characterized by dry, itchy, and red patches of skin that can appear anywhere on the body, but it is most commonly found on the face, hands, feet, inside of elbows, and behind the knees. Eczema affects about 10% to 20% of infants and about 3% of adults and children in the US. Most children outgrow it by their 10th birthday. Some people continue to have symptoms on and off for life. The exact cause of eczema is not fully understood, but it is believed to be a combination of genetic and environmental factors. An immune system response to something irritating. Problems in your skin's barrier that let moisture out and germs in. A family history of other allergies or asthma. Eczema can be triggered by a variety of factors. Some people have flare-ups of the itchy rash in response to things like rough or coarse fabric, feeling too hot or cold, household products like soap or detergent, animal dander, respiratory infections or colds, stress, and sweat. The symptoms. Eczema can affect people of all ages, including infants. In fact, eczema is quite common in infants, with about 10% to 20% of infants developing the condition. In infants, the itchy rash can lead to an oozing, crusting condition, mainly on the face and scalp. It can also happen on their arms, legs, back, and chest. If you suspect that your infant has eczema, it is important to see a doctor to get a proper diagnosis and treatment plan. In the meantime, you can help manage your baby's symptoms by keeping their skin moisturized, avoiding irritants and allergens, and using mild, fragrance-free products on their skin. Symptoms in children. Eczema is a common skin condition in children and can cause a range of symptoms. Children and teens usually have a rash in the bends of their elbows, behind their knees, on their neck, or on their wrists or ankles. The rash turns scaly and dry. Treatment for eczema in children may include using emollients, topical corticosteroids, or antihistamines, as well as avoiding triggers and keeping the skin moisturized. It is also important to help your child avoid scratching the affected areas, as this can worsen the condition and increase the risk of infection. Symptoms in adults. Eczema can also affect adults and can cause a range of symptoms. The rash usually happens on your face, the backs of your knees, wrists, hands, or feet. Here are some common symptoms of eczema in adults. Dry, itchy, and scaly patches of skin, which can appear on various parts of the body, including the face, hands, feet, inside of elbows, and behind the knees. Skin that appears red, inflamed, and swollen. Thickened, leathery skin in the affected areas. Blisters or oozing in severe cases. Intense itching, which can cause you to scratch and rub the affected areas, leading to further irritation and potentially infections. Changes in skin color, such as lighter or darker areas of skin. Cracks or fissures in the skin, which can be painful. Sleep disturbances, as the itching and discomfort can interfere with sleep. When to see your doctor. You should see your doctor if you experience any of the following symptoms: severe or persistent itching, pain, or discomfort. Skin that is swollen, oozing, or blistering. Signs of infection, such as pus, fever, or red streaks around the affected area. Worsening or spreading of the rash. Skin that becomes thickened or discolored. Skin that is affecting your quality of life, such as interfering with your sleep, daily activities, or social life. Diagnosing eczema usually involves a physical examination and a review of the patient's medical history. The doctor may ask about any family history of eczema or allergies, as well as any exposure to potential triggers such as irritants, allergens, or stress. In some cases, the doctor may also order additional tests to rule out other skin conditions or to identify potential triggers. Is eczema contagious? No, eczema is not contagious. Eczema is a non-infectious skin condition that is not caused by a virus, bacteria, or fungus, and it cannot be spread from person to person through contact. Eczema is a chronic condition that can be triggered by a variety of factors, including genetics, environmental factors, and immune system dysfunction. While it is not contagious, it can be uncomfortable and may cause embarrassment or social anxiety in some individuals. Treatment can help manage symptoms and reduce the frequency and severity of eczema flare-ups. The treatment for eczema aims to reduce inflammation, relieve itching, and prevent future flare-ups. The treatment plan may vary depending on the severity of the condition and the individual's symptoms. Some common treatments for eczema include topical corticosteroids. These are creams or ointments that are applied to the affected areas of the skin to reduce inflammation and relieve itching. Topical calcineurin inhibitors. These medications are used to reduce inflammation and improve the skin's ability to retain moisture. Moisturizers. Applying moisturizers regularly can help to keep the skin hydrated and prevent eczema flare-ups. Antihistamines. These medications can be used to reduce itching and improve sleep quality. Wet wrap therapy. This involves applying wet bandages over moisturizers to help soothe the skin and reduce inflammation. Light therapy. Exposure to certain types of light can help to reduce inflammation and improve skin healing. Immunosuppressants. In severe cases, medications that suppress the immune system may be prescribed to reduce inflammation. In addition to these treatments, it is important to avoid triggers that can worsen eczema symptoms, such as irritants, allergens, stress, and certain foods. Your doctor may recommend lifestyle changes or modifications to your skincare routine to help manage your symptoms.